Hi, I'm Dr. Luke Pogue, and today we're going to talk about sleep hygiene. Insomnia is a very common problem, and I see many patients who deal with insomnia, and sometimes they want me to help them with that. I'm really happy to try to do that because it's very gratifying to help people get better sleep. Sleep is very important to our health, but sometimes we have habits around sleep that are detrimental to the quality of our sleep. So, sometimes there's underlying causes to insomnia, and I always want to make sure people aren't dealing with depression or anxiety or chronic pain or sleep apnea that is causing their insomnia, because these are extremely important to address. But sometimes it's just more about sleep habits. The patient doesn't have depression, doesn't have an anxiety, sleep apnea, or some other underlying condition, but they have some habits that don't lend themselves to good quality sleep. They might be watching TV in bed, they might be drinking alcohol before bed. So I always want to make sure that we're encouraging good sleep through good sleep hygiene. A lot of people are familiar with dental hygiene, but not as many people are familiar with the term sleep hygiene, which is just having good habits that facilitate good sleep. So I have my top 10 list of sleep hygiene habits, and we'll start with number 10. Avoid alcohol before bedtime. A lot of people have this habit. They might have a nightcap, one or two drinks in the evening, and a relaxing way to spend the evening, and they find that it helps them fall asleep. But however, the sedating effect of alcohol, once it wears off in a few hours, there's an arousal that happens that wakes us up. So typically 3 to 5 hours after your last drink is when you'll start to wake up and be kind of unable to get back to sleep. So number 9, do not snack right before bed. This may sedate you just like alcohol might, but the digestive process and the unsettling effect, and also just the overall impact on weight and obesity does not facilitate quality sleep. I don't want you to go to bed hungry. Have an adequate supper, maybe even a snack, at least 2 or 3 hours prior to bed if you feel like you can do that. A lot of people want to avoid it because of other health issues, weight concerns, and that sort of thing, but don't snack right before bed. Number 8, reserve the bedroom for sleep and for sex only. No technology in the bedroom, so don't be on your phone, don't even be reading. Housework, laptops, television, all these things kind of get our mind going instead of relaxing for bed. So I don't want you to do anything but sleep or sexual intimacy with your partner in the bedroom. Number 7, don't keep your phone in your room while you sleep. That's another kind of related issue, but it's been shown that people who sleep with their phone in their room, using it as an alarm clock, I know there's white noise apps on there, a lot of reasons we feel like we need our phone in our room, potential urgent phone calls, but if you can keep the cell phone out of the room, that's going to be important and has been shown to improve quality of sleep for most people. Number 6, deal with your worries during the day or the evening. This might take the form of prayer or meditation or journaling or conversation with your spouse. You might have a worry book that, even if you are kind of going to bed and you think of something that might kind of catch your mind and get it worried about the next day's event, you write it down in that book, and that's your worry book, and you say, okay, I'm going to deal with that tomorrow. That's for tomorrow. So physically putting that worry somewhere else besides in your mind. Because if we don't deal with our worries and stress during the day, we're gonna mull it over at night. We're gonna be thinking about what happened yesterday at work, or what's got to happen tomorrow, or family stresses, all these things. Whereas if we have a practice of either writing down or even just giving ourselves, I like to give myself a 15-minute time of reflection on, as a Christian, I just reflect on the love of God some nights for 15 minutes at the recommendation of my pastor. And that kind of puts, lets all the static of all the worries and fears and maybe negative feelings, or kind of settle and have a more positive focus, and allow, give those stresses over. So that's one way I do that practice. Another way to deal with stress is exercise. So number 5 would be exercise regularly, preferably not within 4 to 5 hours of your bedtime. So, going for a run right before bed and then showering and expecting to go to sleep right away is kind of unrealistic. I still like to play basketball, but I can't play in these summer or these evening basketball leagues because I'll just be revved up after the game for several hours and can't get to sleep early enough. Sometimes I'll go out and walk the dog 100 feet just to let her out before bed, and that's kind of relaxing for me to enjoy the night air. But vigorous exercise in the hour or two before bed, not really conducive. But exercise in general, a good stress relief, good way to improve our quality of sleep, kind of tire our bodies out as well as our, give our stress an outlet. Number 4, make the bedroom environment conducive to sleep. This may involve getting better shades that absorb the light, even some of those kind of eye coverings that you can get, or just a shirt over your eyes can help if you're going to sleep past sunrise. Adjusting your bedroom to where it can be somewhat quiet. Maybe you pick a bedroom, if you have an option, that's in a quieter place of the house, or sometimes using white noise apps can be helpful. So that's important to make the bedroom as conducive to sleep as possible. Even the paint color that's been shown matters. Having a blue color may help in some people. So number 3, have a relaxing bedtime routine for the hour before bed. This won't involve technology. You're not going to be on your phone. You're not going to be watching TV. Certainly not going to be watching television in bed, as we said. But it may involve reading. It may involve a bath, herbal tea, perhaps the journaling or prayer or meditation time, but just kind of a winding down time. And then number 2 would be, don't worry about not falling asleep. So a lot of people, they have that, I have to sleep my 8 hours, and I'm not. I'm only sleeping 2 to 3 hours. Where, probably they're sleeping more than 2 or 3 hours if they're in bed for an adequate amount of time, but they get frustrated they're not asleep, and then they worry, that all day they're kind of in the back of their mind, they're worried, am I going to fall asleep? And the harder you try to fall asleep, the less likely, as you probably have learned if you're watching this video, less likely you are to fall asleep. If you try less, in fact, a nice kind of fun trick to play in your mind is to try not to fall asleep. To say to yourself, okay, I'm not gonna sleep all night. I'm just gonna lay here, and I can guarantee you're gonna fall asleep. And also, just to reassure yourself that if I don't sleep well tonight, it's not the end of the world. I'm still gonna function. You're not gonna experience detrimental health effects because you don't sleep well tonight. The problems with health in our culture, detrimental effects of lack of sleep is not because people are struggling to fall asleep. It's because maybe they're working late into the night, they're watching television in bed, they're drinking before bed, and they're not sleeping well because of those issues, not because they're kind of stressed and they're not sleeping efficiently. So just reassuring yourself, it's okay if I don't fall asleep, because it's not gonna hurt me. I'll still function. I'll be tired. I'll feel kind of lousy, but it's gonna be okay. And then number 1, set a consistent sleep schedule, and especially a consistent wake-up time. You can learn more about this in my sleep restriction video, which talks about another way to deal with sleep issues that's very helpful, called sleep restriction, and it starts with picking your wake-up time. So thanks for checking out this video on sleep hygiene. Have a great day and a good night's sleep.